Welcome to Laptop Radio. Today's show, the topic is changes in the telemedicine landscape, and I have Travis Bond, the CEO of Fern with us. Hello, Travis.
Hello.
How are you?
I am doing well. How are you doing?
I'm doing good. Tell us your story.
Well, thank you. I appreciate the opportunity. I think I'm really kind of a prototypical entrepreneur. I've been in the sort of healthcare technology space for a little over 20 years. I've always been fascinated by things that are broken, and I think that any of your listeners that know anything about healthcare would probably affirm, either in personal experience or professional, that healthcare is broken, despite the fact that it's so complex in the United States compared to other countries. We just seem to spend more and make it even more complicated than perhaps other countries. And our outcomes really aren't higher in terms of the fact that we probably spend 3 to 1 on dollars to the next sort of developed country. But, as an entrepreneur, I've just been fascinated by, things that are broken and the opportunity to fix them with new tools that develop and come into use. It's made for, even for me being ADD, it seems to be entrepreneur and healthcare has kept my attention now for 20 years. So I enjoy what I do.
Awesome. What is Fern Health?
Fern it's a great company. We really are just, experts in pain. We really set out and looked at sort of the landscape and, where are the opportunities in healthcare to make a difference. And I think one of the things in healthcare that doesn't really get all the sort of the name brand recognition, say cancer or diabetes or something, really is pain. And when you think about pain, I mean, it's obviously a very unpleasant response and stimuli to have, but when you try to understand its origins and how you would fix it or you would treat it, it really becomes very, very complex. And so again, kind of going back on loving to work on things that are broken, pain is a very sophisticated animal to try to manage. And so specifically at Fern, we are a digital health platform that is treating pain. Our first phase in our sort of pain journey, if you will, is being experts in musculoskeletal pain. When you start to unpack musculoskeletal pain, you'd be amazed at what really has become sort of a simplistic term is a very complex landscape. So just a great and neat area to be in because there's really just so much unmanaged pain in the world.
Tell us more about musculoskeletal pain or MSK pain because I know a little bit about it, but I don't know about that pain in detail.
I know, for those who are kind of in the space, we abbreviate as MSK because musculoskeletal is actually you get points if you spell it right the first time in any document, and you always hope that autocorrect will catch it. But it really is just about the muscles in your body and the joints. And so where muscles attached to different bones and those areas that go bend, they get frequently hurt. And when they get hurt, they either repair themselves or a micro damage will sort of exist, and other muscles they'll sort of compensate. And so when you think about musculoskeletal joint, you think about hips. So that's like one of the biggest sort of sets of joints in our body. There's over 20 muscles that sort of involve the movement of the hip. And when you think about, well, that sounded neat, that sounds painful, I can identify it. But when you quantify it, it's really kind of crazy because Americans actually spend about $380 billion on musculoskeletal conditions. And that sources from health metrics and evaluation. But when you think about the $380 billion and the people who suffer from it, you actually have a bigger count than cancer, heart disease, and diabetes combined.
But why are the current solutions not effective though?
It's a great question because you would think that it would be, right? But I think there's two. And so we'll start with the first one that sort of just seems to be everyone's natural native response to pain. You just stop. So whatever that stimuli that's hurting you, you avoid it. So taking your hand off a hot stove, it's wired into your brain. And you're like, oh, I'm not gonna touch the hot stove. But if it's a knee, it's an ankle, it's a shoulder, it's a neck, you'll rest. And so it's actually the resting, it's the immobility that actually then becomes part of further aggravation. So other muscles are like, okay, well, wait a minute, you don't usually use me this way, but now you're leaning to one side because you've hurt another side of your body. So rest becomes kind of the default that most people sort of natively say, okay, this is how I'm going to treat this pain, which actually is not, statistically, it's really quite bad. The other side of the coin is I'll rush out to the doctor. And this actually creates its own set of complex problems because what you do is you walk into a doctor with a general complaint of my back hurts or my neck or my knee. And so there's not really a lot you can do other than sort of a light physical exam. So the next sort of course of action is what? It's imaging. And the data that's come out of the studies is that imaging is actually quite misleading. And so we have rest as being one of the ways that we would naturally respond that actually ends up making most of the musculoskeletal problems worse. And then we have sort of the complex journey of a very high priced healthcare system in the United States that starts to give us false positives, if you will. And so if you're over 30 and you get an MRI of the spine, chances are they're going to find some abnormality. The problem is that most of those abnormalities have no real clinical manifestation, meaning that it's just part of your body getting older. But that sort of maybe misleading indicator plus a complaint of pain sort of now leads you into the next set of journeys. And so this is where you can get involved with pain treatments. And so you may get a really strong pain reliever, go home and rest. And so now you're kind of doing the worst of everything, right? And so you're not really treating the body, you're sort of masking the pain. And so, that's really kind of where we found ourselves. The fact is that there's really never good, clear evidence as to whether this is something that the body will heal itself if I sort of direct it, or if I get involved in a complex healthcare system, they may overprescribe a lot of things and create a journey that ultimately for many will lead into, especially chronic, something that's lasts more than 6 months per se, can actually lead to spine surgery. And so and that actually doesn't have a lot of great outcomes.
Why would education, exercise therapy, and health coaching be the most effective combination treatment? I saw that on your website.
Yeah, thank you. I think this is part of what's just fascinating, Michelle. I mean, if you really study pain, you start to find that it's really hardwired to so many other things in your body. And so when we think about chronic pain, you really need to here's another long word for you, biopsychosocial. And so this is the interconnection between the biology and the psychology and the socioeconomic factors, another 50-cent word. But really what happens is we'll kind of go back to, let's say you've hurt your back. Maybe you were picking up something at work or getting out of the car in a funny way, and ouch. And so what you find is that you really now have a biological issue. So you have a physical muscle that you've hurt, and that's tissue related. But what now happens if that doesn't get resolved? So we'll kind of go back to you going and say laying in bed for a couple of days thinking it'll go away. If that pain now becomes chronic, you actually start to rewire your brain in areas that is actually, from MRI scans, show that you create a new super sensitive to pain. So kind of think of like a sunburn, of how sensitive your skin would be after a sunburn. So if you're constantly sending these pain signals to your brain, you'll find out that now physiological changes are happening in your brain. And the problem is that it's the same centers in your brain that are responding to and giving you the understanding, the cognitive understanding of pain, is actually next to the same areas of your brain where motivation comes from. Your emotions, for love and hate and so forth, and even our reward system. And so what happens is that sort of this mechanical biology leads into psychology. And what then happens is you can think about all your behaviors that change. And so now this starts to think about your relationships and your performance at job. And so all these sort of socioeconomic factors. And so one of the things to really sort of get your hands around really pain is recognizing that really it is multimodal, if you will, right? In the sense that you can't just sort of take a pill for it and cure it. So if you have high blood pressure, there's a pill and maybe a change in diet, and it's kind of the scope. But if you have pain that's not resolving, it starts to impact really not just the way that you're interacting and the way that you now maybe even ambulate, right? Move, but now it can really just affect your relationships. And so when we say about education, we're really talking about pain neuroscience education. And so this is really about training your brain for pain, if you will, right? And so that is just really an important part, is to help you sort of understand what is going on in your brain so you can get in front of the pain.
Awesome. It sounds like an all digital program. Do you feel that there's a need to be at a physical location to meet with a physical person in order to manage the pain?
I think that is a great question. And it reminds me of medical school, right? So if you studied to be a surgeon, every problem required surgery to correct. And so I think what we've really seen, especially as we kind of, really talk about today's topic more in depth about really the changing landscape of healthcare and telemedicine is that, especially with pain that has its orientation of musculoskeletal, is it can become chronic. And so if it gets sort of too bad, if you will, you need to engage. If you think about what the treatment may be, if it involves physical therapy, it involves going and seeing doctors, then this becomes an access issue. And so the question is it what works most of the time? And when you have something that can't be treated sort of on the spot, like resetting a broken bone or a cast, or you now have high cholesterol, so you put on a statin, you're talking about pain and ways to now basically get your body to restore itself and your understanding of pain if it can't be permanently resolved. You're
Mhm.
talking about a long-term program. And so the longer a program is, now we get into the area of adherence. And so the expense of engaging formal healthcare time and time again. And so let's say that you would do 6 weeks of physical therapy as part of, say, a comprehensive plan. You
Mhm.
could spend a few $1,000s in actually going to a physical therapist just in copays,
Mhm.
which, as we all know with high deductible plans, that is going to be all on you, the person. And so would going, if you live next door, to a physical therapist or a doctor you could sort of walk across with, that might work, but even it has its own limitations from sort of just being open to 9 to 5. So when we think about how are we going to manage pain, how are we going to look at ways to manage musculoskeletal pain? Yeah, digital platform works because this really gets to be where the things that, are very important. So it's about privacy, it's about access, it's about controlling costs.
Mhm.
These things we all know can be now done digitally. And the nice thing about some of the things about digital, and this is sort of kind of the irony that I was trying to figure out, sort of a good analogy. If you've ever gone to a massage therapist, I don't think any of us could ever say that we had the same massage twice. And so there's this infinite, almost individual variability with a massage therapist to the massage you get, even though you say deep tissue, right?
Mhm.
The same thing exists in physical therapy. These are still people that are taking the interpretations of their training and they're applying them in the ways that they sort of, almost as a massage therapist, have their individual approach. Problem is that according to literature, that's over 40 something thousand variations. And so going to a place that has a human element of variability doesn't really give you the best outcomes. But if you have a digital plan that is using, techniques like computer vision and other types of adherence tools, and you're able to watch videos and so forth, that you can reproduce something that has been standardized back to clinical evidence, then the repeatability of the quality that you get in a digital platform can arguably be better than some of the specialty clinics that you would go because of human variability. And then obviously digital is almost sort of frictionless, right? You can open up your phone app at any time, right? And
Mhm.
so whereas going to healthcare, you have to make an appointment, you have to get off of work, and sort of these other barriers then really become very problematic to get good treatment.
Awesome. And what are some of your customer experiences like?
I'm glad you asked that, actually. They've been very positive. And so I think one of the things that, when we sort of set out to build Fern, we were like, our mission is, sort of really what we were going to ground to was, we're going to deliver innovative technology, but with compassionate services to really guide people towards a pain-free life. When we, when you give somebody something that treats something so unpleasant as pain, they're grateful. But when you then pair them up with a health coach, which is important for us because it creates this therapeutic alliance, right? It creates a level of familiarity. It gives you the opportunity to sort of ask questions and say, look, I'm feeling this. Is this normal? I'm partway through the program and now this is hurting, or this feels better. Is it supposed to? Or I'm doing these exercises and it hurts after. And so is this a good pain? Like going to the gym that we would all associate immediately of my muscles are sore because I'm getting bulk. People that are trying to go through cure, sometimes they don't know if it's a good pain or bad pain. So our experience is really like appreciative. Thank you for the privacy, and thank you for the fact that it didn't really cost them anything, because our current financial model is really, it's an employee model from employers. So it's sponsored by employers. So overall, it's been, from a subjective perspective, they've been very grateful. From an objective perspective, some of our outcomes from our clinical trials have just been really superb. And so we've been really excited about that. So our journey in being masters of pain has had some really good results so far.
How effective is the program?
Very good. I'm going to give you some statistics from some of our studies. And so over 53% an average in terms of just pain reduction. When
Mhm.
you look at that from a literature perspective, that's actually twice as effective as opioids. And remember that opioids are a temporary solution. They're
Mhm.
not permanent, so there's masking. Over 70% of our members have a clinically significant pain reduction. And so there's a threshold clinically that there's different sort of question sets and other indicators that you can use to whether something is clinically significant or not. We've estimated that we're saving nearly $3,000 to a person in terms of avoiding medical costs that are associated with kind of those traditional approaches like going to the doctor. And we had nearly 100% of people say that they would use the app again or refer a friend. So we've used some of the standard clinical methodologies of saying, are we on the right track? Are we actually impacting people? We've also had, nearly a 40% increase in function. And so that's one of the things we haven't gotten in today. But if you think about if you have pain and how that could impact your job, that's sort of something you can really see. But when you think about pain and the ability to clean your house, right, or do some of the
Mhm.
other things that you need to do, so even you care for children and get on the floor and do things that just require extra mobility. And so all the clinical rigor has suggested that we are on, a greater parity, if you will,
Mhm.
than some of the traditional programs. So it's still early, but it's been really, really good results.
And what is the future of pain management? I know we're early.
We are early, but I think what you're going to see, and I've been in healthcare for a really long time, but I think that what we'll see is we're going to see that not just Fern, but others will continue to advance the understanding that pain is a very complex set of stimuli that impact many parts of our lives. I think that you're going to see a greater level of adoption of artificial intelligence and machine learning,
Mhm.
specifically around the predictive analytics for modulation. And so one of the things that we do in our technology is that we're constantly tweaking. And so we like to sort of think that we're advancing with big data, especially with our partnership with MGH,
Mhm.
which is Mass General Hospital, is that we're really sort of creating a waste for pain, right? And so what makes the most sense for what Michelle is feeling and what her injuries may be or her limitations in function? How is it that she gets a unique pathway to recover in her journey to recovery versus say myself, right? And so I think that what pain is going to be like in the future in terms of treatment is that each of us are going to get this sort of really kind of very specific treatment modality because each of us are different and how we respond to pain is different.
And if folks have questions about Fern Health, where do they learn more about the program?
They can just visit fernhealth.com, what we're doing, how we're doing it, and the things that we're uncovering. We continue to post on our sites and blogs. And so be a part of the journey. And I think that there is just a ton of unrealized pain out there.
Mhm.
I think that we're actually going to, as we sort of respond to the pandemic, I think that what we're going to see and what we've started to see in some of the early literature is that there's a lot of unmanaged pain, especially, specifically in the new ergonomics of trying to work on your laptop from your couch at 10 hours at a time on Zoom. And so there's, I think, a lot of just unhidden new musculoskeletal pain that's going to emerge as a result of us just socially distancing and working in environments that weren't engineered for us to work. Please follow us and be a part of the journey. Give us feedback. And if you like this industry, give us a call. Hopefully we work together.
Their website is FERNHEALTH. And what is one advice that you would like to provide to the community?
I appreciate this question. And if no one heard anything that I've said so far, I would say this. And again, I've trained in formal healthcare. I've been in healthcare for just a bazillion years, it seems like. But I can tell you this unequivocally, that passive patients become dead people. And I know that sounds a little sort of harsh, but I have seen so many times where people have sort of kind of given themselves over or surrendered into the US healthcare system. And many times, them not being educated, asking the right questions, and being really engaged, they've been mislabeled, mismanaged, and frequently many of them die. So don't be a passive patient in healthcare.
Awesome. Thank you, Travis.
Thank you.
Bye bye.
Bye.